because of all we've done, the risk to the American people remains very low. People die from the flu. It's going to disappear. One day it's like a miracle, it will disappear. You hear 35 and 40,000 people, and we've lost nobody. And you wonder, the press is in hysteria mode. To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency.
It raises the level of attention to this as an emergency. I think it opens up funding channels. It authorizes the states and the local governments additional measures that they can take. We see this happening all over. I think 6 states now have implemented statewide schools being temporarily halted. And this is obviously the part of the social distancing strategy, which is really critical at this point. Every day that there's a delay in implementing social distancing strategies, they'll be less effective. Obviously, the virus has entered the U.S. borders. We have not been detecting cases as we should have, and isolated and tracking cases, contacts. I don't think that we were as careful and thorough in detecting cases. And once again, this goes back to the current gap, the delay in testing. The U.S. is really behind in its ability and a capacity to test the people that they need to be tested. The ability to detect these cases has really caused the underestimation and probably not tracking some of these cases that we should have been tracking. So now we have community-based spreading, and so now it's mitigation, right? And epidemic mitigation strategies. It's clear that there were a lot of missteps in the rollout of these tests. They knew the epidemic was coming. I think they had the time to build up test kits. I think there was a situation where early on, the initial tests were not working well. There were some issues with the reagents. Then, most recently, there was a ramp up of diagnostic kits that were sent out. But the centers that performed these tests were missing critical reagents to extract the RNA so that the samples can be tested. And those kinds of missteps are, to me, preventable and inexcusable. These are really major errors in handling public health emergencies like this. And I think this is a situation where the entire country has to come together and work together. The fact that I'm socially distancing, it benefits not just me, but everybody else. So we all have to do our part. So there's that sense of solidarity that needs to happen. We all have to work together. The government really has to use their authority, and they're the duty bearers of coordinating and leading this process. And we need strong leadership, specifically in the testing aspect, and also the cost of medical care and diagnostic testing. Those are 2 things that only the government can really fix at this point and address. And I'd like to see them deal with it very aggressively, as quickly as possible.